popular Johannesburg doctor and DJ, Sindi Van Zyl, is said to have been in between medical aids when she was admitted to hospital, and that was in February. Van Zyl is currently fighting for her life in ICU after contracting COVID-19. Her family and friends have asked for help from South Africans to try keep her alive. To mark her birthday yesterday, her husband, Marinus Van Zyl, created a crowdfunding campaign to try help cover the escalating medical costs. Van Zyl's situation has brought the issue of the cost of private healthcare in South Africa into sharp focus. For an idea of how we should respond to this, let's bring in Dr. Lehlohonolo Majake, who's a public health specialist, joining us now via our video link. Dr. Majake, it's great to have you on the program. Thanks so much for making time. Dr. Van Zyl's story has really been difficult to digest, and has certainly brought home the idea of just how expensive it is to stay alive in a country like ours.
Absolutely, and I think before we move on to the topic at hand, which is about healthcare systems in South Africa, I just want to say that from the health fraternity, we really do wish our own colleague Sindi a very speedy recovery. But you're absolutely right that it has brought to the fore the conundrum that is when it comes to healthcare in South Africa, and I think across the world. And I think particularly now with the pandemic, a pandemic that has really brought to the fore the possibility that death is a realization, resources are scarce, and that there really has to be a thorough system in which when you are sick and you need ongoing care and medical support, that you can get the support. I think one thing that's also challenged is when you look at the Constitution, health is a right, and the right to access to facilities is a right. But that being said as well, state is not necessarily always able to render the service. So then you have other supportive adjuncts in private sector that then step in to assist with that. And I think that's where basically there has this disjunction in terms of should one actually be paying for health care.
Yeah, it doesn't, on principle, it doesn't necessarily feel right insofar as justice is concerned. We'll speak about that in just a moment. This time has also given an opportunity for us as a country to reflect about where we are in our healthcare system. Many people suggesting perhaps there is credence to something like an NHI being rolled out. But would it work in a context where there's this grotesque inequality within the sector itself?
Absolutely. I think another thing we need to ask ourselves is what would the NHI be doing? And the National Health Insurance is essentially looking at how funding will be pulled to ensure that everybody has access to the correct care when they need it. So it doesn't necessarily mean that it will override or, demolish or abolish one spectrum of the healthcare system, which is private at this moment in time. I think under the discourse we also need to have right now is, why is it that South African citizens basically would rather opt to have grotesque, financial expenditure that really impacts negatively on a household when we have facilities that can be able to deliver the services, or rather ought to be able to deliver the services? Because I think often when we have these type of conversations, I've heard a lot of people, even other public health medicine specialists, refer to state as a good cop and private as a bad cop. But do we really have an issue of the facilities themselves, or is the issue the manner in which we're funding healthcare and the manner in which we're ensuring that there actually is equitable healthcare across the different spectra? And you're certainly right. National Health Insurance is one such arm that is supposed to help with that. And I think it is really high time that we start looking at what is it the government is going to do to really fast track it. It's been said that by 2025, we need to have national health insurance. But when you look at it at this moment in time, just how far out are we with that? Yeah. We know in principle we need to have NHI, but on the ground, we're not really seeing the traction that's supposed to take place at this moment in time.
And what's equally troubling is how politicized the issue has become when it really is a matter of life and death, as is becoming more evident, at least during the COVID-19 pandemic. How much time, Dr. Majake, are we spending also reflecting on what is perceived as a lack of regulation within the healthcare system? I mean, we're being told that Dr. Van Zyl's bill is running up to about 2 million rand. That sounds like such an injustice.
So I think in terms of regulation of healthcare itself, there's been a lot of time, and there's actually quite good regulation systems at this moment in time for healthcare. I think one thing we need to understand is when it comes to health, there is still the right as well for individuals to use private healthcare systems. And I think the challenge right now is we have a lot of pre-funded model in the form of, your medical aids. That's the most common one that South Africans actually use. And then we also have your out-of-pocket expenditure. And when you look at instances where any patient is given an exorbitant amount, it usually is because the type of pre-funded model they've actually opted for. And I think this is exactly what the NHI is trying to curtail. If you listen to what previous discourse was around NHI, you will always hear how we need to try and prevent society from having catastrophic financial expenditure from healthcare. What is interesting, though, is I think there's always this misnomer. And I think for somebody who's been quite well exposed to private and also to public healthcare, that private almost has a thumb suck of expenditure, and that their fees, they have high markup on healthcare. Interestingly enough, when you look at various articles, there's a very nice study that was done, published in the SAMJ, that actually demonstrated just what healthcare expenditure would be in state. And it was quite interesting to see that already the study was done in 2008, that the expenses are actually not that far from what healthcare in private sector is. I think the only thing is that, Ayanda, you would get a bill if you have medical age to say, Ayanda, you've been treated, this is your cost. But in state sector, you wouldn't necessarily have that breakdown. I think it's time perhaps society really needs to understand just what is involved in terms of treating a patient, even in public sector, because you have to pay the registrars, you have to pay the doctors, you have to pay the South African Blood Bank servers, you have to pay NHLS, you have to pay the cleaners, you have to get medication, etc. So it really isn't a situation where healthcare and ICU would be 500 in state and 15,000 in private. And I think we need to start having that discourse, and that discourse will understand why it is pivotal that we have a pooling system from a finance perspective, which we're referring to as NHI. Incredibly
interesting. We have touched on this, but I want to bring our conversation back to something you've already reflected upon. The situation that Dr. Sindi and many others find themselves. From your take, is it an indictment on the lack of trust we have in the public sector, on indictment on the private sector for, I guess, being able to amass the type of costs that we speak about, costs that you say actually would also exist within the public sector in and of itself? For people who are trying to, I guess, gauge how we can get to a desirable place, who should be coming to the party?
It's an indictment on the fact that we've held on and politicized, as you correctly said, healthcare. And we've held on to models that we feel would really take us forward with the NDP, and has sort of excluded certain pockets that can also come in and step in, and that is private sector. We really need to start moving away from a situation where we can see that there definitely isn't enough of a demand from a healthcare perspective from government, but also not really want to tip into your public-private partnerships. I think at this moment in time, when I look at healthcare in South Africa, and when we think of private sector, it's been going on for about 30 years. And you look at the sophistication of the systems from IT perspective, infrastructure, etc. And you look at the amount of effort the public has actually put in as well in terms of having more clinics. I mean, there's over 200 new clinics that were built post-94, hospitals, we've seen refurbishments, etc. So there's always this gap. And this gap ought not be there. I think COVID-19 has actually demonstrated that private and public can certainly share best practice. Because at the end of the day, even with private sector, they still do fall within the National Health Act. And they still do want to push for the best quality healthcare service for those, of course, who then can pay for the service itself. Remembering that healthcare systems in private sector, it's also another domain that is really quite pivotal in terms of employment of individuals, etc. So I just think it's an indictment of us really holding on to old principles, historical principles of pre-1994, and still believing that certain role players can't really be fundamental agents of change purely because of the fact that, of the history that we come from as a country. Understandably so, but I think right now, the average South African just wants to see progress. And I think we really need to put the politics aside and put forward the skills that we have, and we certainly have the skills to push this type of vehicle, which is NHI.
On that note, how much space is there for activism from the inside? I can only anecdotally get a sense from young doctors who say often enough they don't feel like they're being heard. Could you say the same is true for activists within the space who, in many respects, are just told to keep their heads down and get on with the job at hand?
I think there is place for activism, but I think the activism needs to also be revolutionized. I think we can't keep thinking about certain spaces the way we used to all the time. And we need to be open as well to innovation. We need to be open to doing things very differently to how we've been doing, because quite evidently if we've been doing this from 94 and we're still stuck in this page at this moment in time, perhaps we need to look at the story and where we want to be, but look at it differently. I think political will certainly is there, Ayanda. That is something that one really can't fault the government on. But I think the issue of the how, and also just doing it in an unorthodox manner, which in this case would be utilize the people that you have, utilize private sector. They actually are here to make healthcare win in all aspects. I think that's one thing. But also at the end of the day as well, we need to also really educate the public in terms of, the services that are rendered and the reason behind the costs. Because I think often many people think of medical aid as a nice to have, and many also often think of private sector just being an adjunct that overinflates its costs, which is not necessarily the case. And I think we need to educate, the population just how expensive healthcare is. It's a social science, but it's a social science that really has very high technology, expensive medications. And I think it's just time we really understand what it is that we talk about when we talk about health as a commodity, because I don't think we view it that way. We still view it in the old school sense of it's a clinic, I go there when I'm sick and I'll get what I need, but we don't quite understand the economics of it, and we need to start having those type of conversations as a society.
Yeah, and I guess as that conversation is had, there needs to be real questions about the ethics behind making a profit in a sector like health, which obviously has to do with life and death. I'll get your thoughts on that very quickly as you also reflect on us on what rights a Dr. Sindi would have given her circumstance. We're told from a family that she was in between medical aids. I mean, does that mean if she doesn't get the bill and the treatment could possibly save her life, that the hospital is still within its right to stop treating her?
I'm going to move away from Sindi particularly, but just use an example of just a general patient and what we have seen. And I think if you look at the National Health Act, it's quite categorically states that when you really have urgent or emergent care and, life, healthcare issues that really will determine whether or not you live, that all facilities are responsible to actually give the health service itself. And I think it's a huge misnomer for people to say that private sector will just simply move a patient away. I mean, we sit with a lot of patients in private, who cannot afford to pay certain bills, but because they're unstable, will continue to get the best care. And remember, we look at a case rate of a patient as well. That's what makes the whole, the cost so high, is that often it will be an individual who is very sick. If you're ventilated, you really are sick. Your body cannot function on its own. So you're already on tertiary or quaternary level of care. And what that means is you need super specialists. It's not just a GP or only a physician. You will need somebody who's specialized and somebody who's gone on to even super specialized that's going to look after you. Even the nursing care will then be that type of nursing care. But I think even in the times of COVID, when we didn't really have enough resources from public sector, private did step in to actually assist with that. So the right to life is always going to be the penultimate right, and we're always going to look at that, irrespective of whether you're public or private, and that will always take preference. And that would be the case for anybody for that matter. They do have the right to life. And nobody will put economics before the right to life of an individual.
Fascinating discussion, and one that I feel is long overdue. Dr. Lehlohonolo Majake, thanks very much indeed. Really appreciate your time.